Okay, so let's talk about the mandibular nerve now. The mandibular nerve is the largest of the three divisions of the trigeminal or the fifth cranial nerve, carrying both sensory and motor fibers. As you can see in this diagram, the trigeminal nerve has three divisions: the ophthalmic, the maxillary, and the trigeminal division. Now, the first two branches of the trigeminal nerve are purely sensory. However, the branch of our concern, which is the mandibular nerve, is a mixed nerve carrying both sensory and motor fibers. It is derived from the first pharyngeal arch and hence innervates all the derivatives of the first pharyngeal arch. Now the mandibular division of the trigeminal nerve arises from two roots, a sensory root and a motor root. So the sensory root is the larger root and the motor root is the smaller root. The sensory root, which arises from the trigeminal ganglion, runs forwards and laterally towards the foramen ovale. And the motor root, which is a smaller root, arises from the trigeminal motor nucleus in the pons and runs deep to the trigeminal ganglion to join the sensory root in the foramen ovale. So far we have seen that the mandibular nerve has arisen from two roots, a larger sensory and a smaller motor, which have proceeded towards the foramen ovale. Now from the foramen ovale, this is a picture of the interior of the skull, and the foramen ovale is present in the middle cranial fossa. Now the two roots unite together in the foramen ovale to form the main trunk. The main trunk descends through the foramen ovale to reach the infratemporal fossa, where it is related to the lateral pterygoid, otic ganglion, tensor palatii muscle, and the middle meningeal artery. So it has come out of the foramen ovale as a main trunk, and here the main trunk gives two branches, which are the middle pterygoid and the nervous spinosum, and then it divides into two small divisions, which is the small anterior and the large posterior. So we have seen it comes out of the foramen ovale, and about half centimeter below the foramen ovale, it divides into its two branches, which are the smaller anterior and the larger posterior branch. Now let's talk about the branches of the mandibular nerve. So there are branches that arise from the main trunk, from the anterior division, and from the posterior division. From the main trunk, we have two branches, which is the sensory, the nervous spinosum or the meningeal branch, and the motor, which is the nerve to the medial pterygoid. And the branches from the anterior division are primarily motor with one sensory branch: the masseteric deep temporal and the nerve to lateral pterygoid, and the sensory is buccal nerve. The branches from posterior division are primarily sensory with one motor branch, so they're auriculotemporal, lingual, and inferior alveolar nerves. Now let's come to the branches of the main trunk. So there are two branches, one is motor and one is sensory. The first branch is nervous spinosus or the sensory branch. It is also called the meningeal branch because it supplies the dura of the cranial fossa. It enters the cavity through the foramen spinosum with the middle meningeal artery to carry sensory fibers to the dura of the middle cranial fossa. Now it arises from the main trunk and passes upwards into the foramen spinosum, and here it supplies the dura. Now let's come to the second branch from the main trunk, which is the nerve to medial pterygoid. So this is the one. So we have just seen the nervous spinosus, which has gone back from the foramen spinosum. It has gone into the middle cranial fossa. Now the nerve to the medial pterygoid passes anteromedially into the pterygoid muscle to supply it. It also gives motor branches which traverse through the otic ganglion without relay to supply the tensor tympani and the tensor valli palatini muscles. So far we have covered the branches from the main trunk, which are the nerve to medial pterygoid and the meningeal branch. Let's go to the branches from the anterior division. Now in the anterior division, we have one sensory branch, which is the buccal, and three motor branches, which are the masseteric, deep temporal, and the nerve to the lateral pterygoid. Let's start by talking about the motor branches. Now the motor branches, the first one is the masseteric nerve. this one. So you can see it emerges from the upper border of the lateral pterygoid just in front of the temporomandibular joint, passes laterally through the mandibular notch in company with the masseteric vessels, and enters the deep surface of the masseter. Okay? And it also supplies the temporomandibular joint in its course. So it passes to the deep surface of the masseter, supplying the masseter, and also in its course, as it passes just in front of the temporomandibular joint, it gives a branch to the temporomandibular joint. Now the second motor nerve is the nerve to medial pterygoid. It enters the deep surface of the muscle to innervate the lateral pterygoid muscle. This is the lateral pterygoid. The third are the deep temporal nerves. So the deep temporal nerves are two, the anterior and the posterior. We can see it here. This is the anterior and this is the anterior and this is the posterior. They pass between the skull and the lateral pterygoid and enter the deep surface of the temporalis here and supply the temporalis. The last branch from the anterior division is the Pacu branch, which is the only sensory branch. So from the anterior division, it passes between the two heads of the lateral pterygoid and runs downwards and forwards and supplies the skin and the mucous membrane related to the buccinator. It also supplies the labial aspect of the gums of molar and premolar teeth. Coming to the clinical anatomy related to the anterior division, the motor part of the mandibular nerve is tested clinically by asking the patient to clench her or his teeth and then feeling for the contracting masseter and temporalis muscle on the two sides. If one masseter is paralyzed, the jaw deviates to the paralyzed side on opening the mouth by the action of the normal lateral pterygoid of the opposite side. The activity of the pterygoid muscles is tested by asking the patient to move the chin from side to side. So these are the functional tests for testing masseter and the temporalis muscle. So let's just quickly recap what we have studied so far. We saw that the mandibular nerve is the third mixed nerve arising from the trigeminal nerve. It comes out of a larger sensory component and a small motor component. From the foramen ovale, it arises as one trunk, which is the main trunk, which further passes downwards to divide into a small anterior and a large posterior branch. Now branches from the main trunk were two. Branches from the anterior division we have studied, which were three motor branches and one sensory branch. And in the next video, we'll study about the branches from the posterior division. Thank you for watching, and I'll see you in the next video.